Okay, good morning, good afternoon, good evening, wherever it is you are joining us from. Thank you for joining us today. This is Living LTV Live with me, Dr. Gbenga Adebayo, and today is our AMA. Ask me anything. Ask me anything. Somebody said, you mean I should ask you anything? I said, yes, really, really ask anything. We are here to help each other learn better, so that we may live longer, more productive lives. So our motto is to know better, live longer. Because I sincerely believe that if we know better, we will certainly, definitely live better, live more productive lives. So thank you for joining us. If this is your first time of joining us, well, thank you so much. Like I said, my name is Gbenga Adebayo. I'm a public health physician, and I'm your host on Living Health TV Live. So today is our AMA. Ask me anything. We're going to be discussing, answering your questions, any burning questions that you may have in your heart. Please go right ahead and ask. Ask, and it will be my pleasure um, to answer. It will be my pleasure to answer. But before we go into that, I'd just like to share a little tip while our questions. So you're asking your questions. We have some questions that we have banked from some people have sent in, asked several times. So we'll be taking those questions. And then, of course, we'll also be taking any question that you, our live viewer, may have. It will be our pleasure to have them. So please go right ahead and just type them in the chat box, and we'll be happy to take them. I just want to share a quick tip with you while we wait for those questions to come in. And that is something you can do right now that will do you a whole lot of good. There's just something you can do right now. If you do it, it will do you lots of good. Do you know what that is? Do you know what that thing is? Please just smile. Smile. I don't know. Are you on your own? Are you all by yourself? Eh, just smile. Smile and laugh. I know things may not be perfect. I know there's war now in Europe. Um, but you smile. You smile that you have an opportunity to be happy. You have an opportunity to do awesome things. You have an opportunity to live again intelligently. If you've made mistakes, things have happened, things have not gone the way you want them to go, okay, that's fine. That's fine. Mistakes are, are there. It's part of humanity to make mistakes. And I don't know what's happening around you, but if you are here, you are watching this, you stumbled across this, just smile. Okay, so if you are watching live, can you please just give me a smile? Give me a smiley in the chat box there. Just smile. It will do you a lot of good. It will be good for you. So, okay, so we're having questions coming in already. Okay, what are the most common conditions and factors that affect female fertility? Okay, so first, let me first say that that question is not correct. That question is wrong. Right? Not that it's wrong, but I think it feeds a stereotype. I was discussing with someone recently when people are praying and they are praying for children. Thank you, May. Thank you, May. Thank you for joining us. When they are praying for children, do you know what they call it? They call it the fruit of the womb, right? Say, God, give me the fruit of the womb. Give me the fruit of the womb. Give me the fruit. Okay, that's fine. So I think I understand what they are saying, that a child, a baby, is the fruit of the womb. But um, that also now fits a certain stereotype that makes it that when there is now a problem with fertility, that it is the woman that has a problem. That, okay, that just means that it's the woman that has a problem. Because why? She's the one that doesn't have the fruit of the womb. That may not be totally correct. In fact, it's often incorrect because there are male and female factors that may be responsible for infertility. So I would have preferred that question. Well, it's not my question, but I think I would have preferred that question to address what are the factors that affect fertility in a couple, because I think that that's more balanced than to say female fertility. What of male fertility? Because a man too can be infertile the same way a woman can be infertile, and we will not know who is having an issue unless we go for tests, unless we go check it out and discover who has a problem. So I will try to answer that question from the more balanced perspective. Thank you, Julian. Welcome, welcome. Thank you for joining us. From the more balanced perspective, that when a couple don't have children and they are trying to have children, because some people may choose not to have children. I've met someone like that, that's what she does. I don't want to have a child. I can't stand children. And she says she doesn't want to have a child. Okay. So don't assume that you see a couple without children, that probably it means that they may not want to have kids. But if a couple have been trying to have children and they are not succeeding, so we now have male factors, we have female factors. So anything that will stop a man from producing viable stem cells will affect his fertility, from producing and depositing, right? Right? Because some people they produce viable stem cells, the sperm cells rather, but they cannot deposit it due to some various factors. It could be some people, when they ejaculate, rather than the sperm moving forward, it can go backward. So that's retrograde ejaculation. That certainly can cause problems with fertility. So anything that will affect is a man from. Thank you, our crew. Thank you, stable, constant crew. Thank you so much, all the way from all over the place. Thank you for joining us. So anything that will affect the deposits of sperm in the man, yeah, the production, transportation, and the deposition of sperm cells in a woman in enough quantity will affect that male's fertility. And that could be so many things, right? It could start with the production. So if something has happened to the man that his testes have problems, it's not producing. So the man is not, and that can happen, infections, right? So somebody has had bouts with sexually transmitted infection. So let's not take them, some people see that it's normal. I've met someone that said to me, thank you, Meryl, thank you, thank you. Some people have said to me that it's normal for a man to have gonorrhea, that every man must have gonorrhea as a rite of passage. No, right? And that part of even if gonorrhea does not affect your fertility, you have your children, if you don't treat it properly, right? Low smoldering gonorrhea can give you big problems in the future, right? So the person has tiny is you will not be having problems passing urine. So you will have this, we call it stenosis. The urethra will have problems, so you will not be able to pass urine, and that can be a painful condition. Not treating, contracting, sexually an infection, and not treating that infection properly, and then leading to those complications. So anything that will affect the production, transportation, and deposition of sperm cells will affect a male fertility. And it is common, Male factors are often a factor in fertility. So it's not just women. So so it's a woman that goes to pray, it's a woman that goes to see a doctor. The man says nothing is wrong with me, I'm fine, because he sees it as something that affects his male status. If they say is infertile, please go for help. Right, go for help. And then of course we have female factors. So female factors, anything that will affect the production of eggs, right? So if somebody is, for instance, you're no longer producing eggs, you've reached menopause. So you'll be infantile, right? So anything that affects the production of eggs, the movement of those eggs, right? Or the transportation of sperm cells to go and meet the egg where it is in the fallopian tube, right? or that will affect. Okay, so there's success, but something is affecting that fertilized egg from implanting. So that person, so the factors are many. So the important thing that we need to know is that in this age and in this time, um, fertility issues can be addressed. They can be taken care of. Even in the Nigerian environment. In fact, I know people that live, so in the fertility space, we sort of have reverse medical tourism. You know, people talk about medical tourism, that people are going outside Nigeria to go and for simple medical procedure. Somebody has headache, he goes to see a doctor who left Nigeria to meet him wherever he's going to treat him. But in the fertility space, people actually travel into Nigeria to take care of their fertility problems. Why? It's cheaper here. It's way cheaper, and the success rates are also quite very high, comparable with anything that you find in the world. So people travel down, people come down to Nigeria to get fertility treatment, get their babies, and travel back. Right. So you can be treated, and it's not crazily expensive. It's something that it's not cheap. True, it's not cheap, but it's affordable. It's affordable with proper planning, and it's there, right? So either it's a male factor, female factor, right? Let's take care of it, right? Great. Any other question? So as you those of that have come in, please drop your questions. Any question? If my answer is leading to more questions, don't worry. Just go ahead and drop your questions there. We'll be happy to take them. So next question, please. What other questions do we have? So we are in our Ask Me Anything. Ask Me Anything. And you can also do something now again. You can smile wherever you are. Just smile to yourself. Somebody might say, why are you smiling? What's up with you? Are you smiling? I'm just smiling, making myself happy, right? So, okay, how long should my partner and I try to, I guess, should have tried to conceive before seeking help for infertility? Okay, that's a simple question. We say infertility is if a couple have been having regular intercourse. And what that regular means, that means at least every other day for 1 year, and they've not been able to conceive, then we say that they have fertility, they are infertile, right? So you must have been trying for 1 year to conceive, and you are having regular sexual intercourse. So don't be saying you are meeting once a month for 12 months. And so we are not having children, we are not having fertility. No, you are not having regular, because a woman will release her egg, right? That egg will live for 24 hours, will survive for 24 hours. Sperm cells can survive for 48 hours, up to 48 hours. So that's why we say every other day. So if you have sex every other day, we are sure that sperm cells are right there in the female genital tract, waiting for that egg to come. And when that egg comes, those the sperm cells that are around, the odds that they will fertilize the egg is higher. So you must have been trying for at least 1 year. Well, having said that, I think the balance also must be struck that if we meet a couple that are elderly, maybe 35, 36 years old, they got married, right? A woman is 36, 37, got married. I'm not going to wait for 1 year, right? Do you understand that? It will probably will not wait for 1 year before we advise such a person to at least be working with their doctor to aid their conception if they are having issues conceiving. So, but the classic definition is that you have been trying to conceive with regular exposure, regular sexual intercourse for 1 year, and you have not conceived, then people say, okay, infertility is in play. Let's manage it. Let's manage it. And the management is not something that you do today and then tomorrow you are fine. So there will be investigations, try to find out what's wrong. Is it the male? Is it female? Or is it both? Because is there something wrong with both parties? And then we treat it. And there could be simple treatments, simple, very simple treatments, simple remedies, and then we are good and go. Right? Thank you so much, Mr. Labode Daramola. God bless you. Or is it Professor? I hope I've, because some people will call them Mr. If it's Chief and I call him Mr., please forgive me. Because it could be, maybe, you know. Thank you. How can I boost my fertility? I really don't know how to answer that, but I don't know how to boost. But I think everybody should just take care of themselves, you know. Somebody close to me recently, she bought something and they said it's going to cleanse. I'm like, cleanse what? But it's a flusher system. If I go and eat apples, oranges, there's really nothing like flush, cleanse, all those kind of. You're just wasting your money, right? So rest well, eat well. If you are having problems with fertility, like you have been trying to conceive and you are not conceiving, go see your doctor, right? Then we can check. Are you healthy? Just do normal tests. Are your hormonal levels okay? Um, and then then if your hormonal levels are okay, all we just say is stay healthy for the woman. Use enough. If you're in the reproductive age and try to conceive, be on folic acid to aid cell regeneration, so that if you get pregnant, also we can prevent neural tube defects in children, because folic acid is very important for that. So in boosting your fertility, be careful of all these remedies that say, I will do this, we take this, you will do that. Oh, Reverend, thank you. You see, that's why it's good to ask before I say Mr. Thank you, Reverend, sir. It's good to ask so that we can find out who we are talking to. So I celebrate and acknowledge you, Reverend, right? Okay, so that's what we are saying. Um, so boost, be careful with all these things. I can remember a baby that, let me not go to that story. So let's just be careful. Anything that say you take this, you take that, boost that, please work with your physician, right? Work with your physician. Are fertility issues hereditary? Can it pass from family, from I guess from individual to individual in a family? That's what that person is asking. Now, depends on the cause of the fertility issue. So if the cause of the fertility issue is something genetic, that has a genetic component, so there could be an hereditary or genetic component, because of course, if it has a genetic component and you are a member of the family, then the odds are that it can pass to you. So that someone in your family has, so there could, if for instance the cause of the fertility issue has to do with something that affects the genital tract, has to do with some condition. There are some conditions that can affect the reproductive tract. It could be the tumors, malformations, and stuff like that. And if that has a genetic component, then certainly there can be. So that's why we say go for investigations. Let's find out what is wrong. Speak out. Don't be ashamed. Don't be afraid. Like I said, there's no fertility issue. It can be addressed. Even people that have reached menopause, there are options for them to still have a baby, right? To still have a baby. There's egg donation, there's sperm donation, artificial insemination. If your womb, if you say you don't have any womb, but if you have ovaries producing eggs, somebody else can carry that baby for you. You can have a surrogate mother. They'll take your egg, take your partner's sperm, fertilize it, put it in somebody. 6 months after, the baby is yours. You go do a genetic test. You find out that baby, you and your partner, the parents. So there's really no there are few obstacles right now that there are obstacles. Certainly, there are some people that have tried that it fails. Don't get me wrong. It's not that it's 100%, but if you don't try, you won't know, right? Do you understand that? So let's go get for help. Let's get help. What is the proper diet for older people? I see your question, OBG. I will come. What is the proper diet for older people? Well, um, I think as we get older, of course, our bodies are not the same. But I read something recently, it's very interesting this week, that a research was done in in mice, and they turned back the genetic clock in those mice. I was excited. So, so the mice that they just became younger and their bodies were the body, because if you know, as you are growing older, sometimes age just catches up. You don't discover there's some things I could do, I can't do them anymore. There's a way your body feels. But so from that, I hope maybe in the next few years we can say happy 500 birthday. You are 500 years old, you're 250 years old. But for now, we have not got there. So it's important, of course, as you go older, that you recognize that your body is not the same way it used to be. So we'll cut down on those things that our body may find it more difficult to handle. Yeah. So I would advise that you cut down on simple sugars. You come down on meal size in general. I've always told you that the most important thing about food is what? The portion, right? Portion and composition, certainly. So eat more greens, eat more leafy vegetables, stay more active, right? More fiber in your diet, and a lot more water, fluid will be helpful to help you live better. Okay, OBG asks, is COVID still a danger in Nigeria? COVID has not gone away. COVID-19 is still very much around, Somebody shared, I guess they are joking, they say, oh, the war has cured COVID. No, it's something has left the consciousness of the media, right? Does not mean that that thing has gone away. It just means that they have more, the people are more interested in the other things, and they are chasing eyeballs. So the eyeballs that they are chasing are the things that they want people to watch. It doesn't mean COVID is no longer an issue, right? We're just still lucky that for various reasons, COVID has not been the horrible, terrible thing we were afraid it was going to be. So COVID is still very much around. So go get your shots. I think the best thing you can do for yourself, if you've not got your shots, go and get it and still practice hygiene. Let's still practice the basic safety processes, and hand washing. Right? Even if COVID is not there, hand washing protects you from other things, a whole lot of other things. We've known for many years that hand washing is the single most protective thing against infectious diseases, right? So colds, diarrhea, and all those funny diseases that move from one person to the other, disease of hygiene. So hand washing, covering your nose, using face mask whenever you think you have a cold. So the guidelines have changed right now. So, but if you are still in a public gathering, you're in a place where many people are, it's still advisable that you use your face covering. So COVID is still a danger, not just in Nigeria, globally, and we're still worried. The COVID doesn't know that there's war, right? We're still worried about a mutation happening. So there are some underground stories. If you read, there are still some stories about a new variant coming out after the Micron variant, but we're just open and praying. But somebody said hope is not a strategy. So let's go get our shots. Let's still go get our shots, right? Right. Let's stay safe. Can too much sweating be a concern medically? Yeah, it can be a concern, especially the concern to the person sweating too much. So we need to know what too much sweating is. Because if you are sweaty, and you are not replenishing the fluid, you can be dehydrated, and dehydration can be a medical concern. So if somebody is running up and down and it's exercising, sweating, and does not replenish that sweat, or the weather is so hot, then you can run into trouble. So, but what I imagine that you are asking is that somebody sent me a question, say my daughter is 10 years old and she's sweating. I want to buy deodorant for her. What do you mean? She says, 10-year-old girl, please let her sweat. You are the one that is very careful and say she's sweaty. When she plays, she sweats. You don't want that to sweat when she plays. Please let the baby sweat. So sweating is good. In fact, somebody said that sweating is a shame, but there was a BBC story recently about the power of sweating, about sweating makes us different as human beings. So, but if you're not worried about your sweatiness, the smelliness, and the stickiness and all that, see your physician, talk about it. Sweat in itself doesn't smell. Yeah, sweat in itself. What makes sweat to smell, or what gives a body odor with somebody that smells, are bacteria that you find in the person's armpit that feast and act on the sweat, and then they give the odor that you may be perceiving. So, basic thing that you can do if you think you are a sweaty person, bathe often, keep cool if you can keep cool, right? Mind the kind of fabric you wear. Colors also may be important because dark colors tend to retain heat, and then you can sweat more with dark colors. So, but sweatiness in itself is a normal human reaction to things that happen. So manage the things that cause it, especially the social. If you feel it's becoming socially awkward for you when you go about and your shirt, everything is sweating, because there's a way people may perceive you. So you may need to have change of clothes. You may need to use things that may help you to sweat less and be more aware of what you do and how you do it, right? Fantastic, fantastic. Is it true that aluminum-based antiperspirants are dangerous? Well, I think we did a video some time ago about does deodorant cause cancer and all that. The evidence right now is that there's nothing that says to us that deodorants cause cancer. Not the evidence does not suggest that, but there is some evidence that suggests that aluminium-based deodorants may, that it's possible, but we don't know on the weight of it. It's not that it's possible that they are a factor in malignancies of the breast and stuff like that. But we don't know for sure. It's not, the evidence is not yet something that we can say definitively that this causes aluminium base. So we don't know. I think that's what we should say. That's what the evidence does not tell us, does not show to us that aluminium base is not clear cut. There are some studies that suggest it, but it's not clear cut. So if you want to ask for advice, if you can do without it until the evidence is clearer, maybe you can do without it, right? That's what I would advise. But we don't know. It's not clear. All right. Is there a medical treatment for sleepwalking, both for adults, for children and adults? Yes. Please go see your psychiatrist. Let's see your psychiatrist. Yes. See your physician, see your doctor. Let's find out night terrors. What are the things? So often, what may cause this in people may be unresolved trauma, sleep disorder, because this is a sleep disorder. So our sleep disorders are managed by psychiatrists. So please, yes, medical treatment. See a psychiatrist. Let a psychiatrist talk to you, find out what is up with you. Is there something with the brain? Is there something wrong physically with the brain? Let's treat it and take care of it. Take care of it. That's it. Is it okay to take blood tonic and other supplements every time? How often should we take them? I don't think we should take something every time, unless it's prescribed, right? Unless there's a reason for it. I remember somebody close to me one time, I was just taking supplement, and she went for and found out that those supplements she was taking, she had 1,000 times the dose of what she should have. So there's something called hypervitaminosis. You can have too much of certain vitamins that can harm you, right? They can harm you. So don't say it's natural. You know, people say all that kind of stuff. They say it's natural. It's natural. This you can't do this. It's just to no. Be careful, right? And a lot of all these vitamins that people prescribe and give you, take this one out, and then they put it with a multi-level marketing. Um, say this to do this, to be careful, right? Be careful. So if you are not eat well, that's what we say. And then of course there are some certain groups of people. The only group of people that I think I know of right now, off the top of my head, that we say should take supplements are pregnant women, right? So a pregnant woman will need to take a supplement because she's carrying another life, and that life is taking has a lot of demands on our, even on our body. So we take your iron, because a lot of women in our environment have been issue um, before they got pregnant. Their blood levels were low, so they need to take that because they are still going to lose some blood. Delivery is not bloodless, you know. So it's still going to lose some blood while delivering their baby. So and then they can tip over to anemia. No, bleeding is one of the leading causes of death among pregnant women. And then, of course, the baby also is developing. So it needs a lot of nutrients. So we take supplements for our, our, our pregnant women. And then, of course, maybe a woman has reached menopause and has now having all those menopausal changes, bone changes. So the person may be given calcium to help with some of those changes. But to just say everybody should just be taking, there are some supplements in fact you should not take with age. You shouldn't be taking folic acid in your 60s, in your 50s. You're just taking folic acid. You may be promoting cancers, you know, because you will just be promoting all kinds of stuff. So don't take any supplement, right, without your doctor saying so, without working with your doctor, based on what has happened, what they've done your checkup, did my stuff. No, so don't just to any is this what I would advise you to do is to eat well. Please eat well, feed well, and some people will say, you just kind of your doctor. Well, I have no skin in this game. I'm just trying to give you what is best, right? All right. Um, when should I see a doctor about a headache? So everybody will have a headache one time or the other. We all something or the other. Headaches are one of the most common things that happen around. But if you're having a headache, that headache is persistent, right? It is there long term. You've been having a headache for months. Please go see your doctor. If that headache is getting progressively worse, yeah, go see your doctor. Go see your doctor. You hit your head some weeks ago, and then you just see that you're having the headache is getting worse. It's getting worse. It's getting worse. I know someone that died like that, slow leaking. No, he hit his head, blood started leaking into his brain slowly. Weeks later, he was dead. He had a headache. He just no. So you need to. So if you're having a headache, your headache is getting worse. You just start to get associated with other things. You're vomiting. Your hand is paining you. You can't move. So please, go see a doctor. So the headache that is getting progressively worse is there. It's associated with other symptoms. Please go see a doctor. Right. Someone told me recently that for eye checks, it's, it's better to go out of the country. Any trusted eye clinic in this Lagos? Not true. It's not better to go out of the country. In fact, people out of the country are coming into the country to set up eye practices, right? Set up eye practices. So I really don't know what you're complaining about that is wrong with the eye. So if it's there's really there are not many things that cannot be taken care of in the country if you have the right people. Reverend, you can reach out to us later. We have friends that have great eye practices. I have colleagues that I would gladly send you to go talk to them. Let's know what's up. And even the government hospitals, you know, yeah, okay, so we go to a government hospital. Yes, they take time. They might not give you a queue and all that, but ultimately you can get good care in our government hospital. There are eye practices. There are friends that work in some of these eye practices in government hospitals, and they are doing the best. They're doing good jobs, both all over. They're doing complex surgeries. They're doing simple surgeries. We have private practices right here in the country that do complex surgeries. They do it. So it's not true. So let me just say that it's not true that the eye checks, even for eye checks. No, I'm not even talking about checks now. Even interventions, complex eye interventions are done safely in Nigeria in super specialty practice. We have super eye specialty practices all over in Lagos, Abuja, different places that are doing fantastic things. Fantastic things. Right? Okay. So, Reverend, you can reach out to us later, sir. Would just reach out to one of our admins. We'll be happy to point you in the right direction. Right? Even government hospitals, like I said, they will take care. I don't know what is the issue with the eye, but it is they can take care of them, right? Okay. We have spent 36 minutes today. If there are no other questions, I think we've had a good ask me anything. And people have asked me anything. Uh, if you still have any other question, please go ahead and ask. But not seeing anyone, I assume that we are through for today. You can still go ahead and drop questions in the comment sections even after this video. Or if you're watching, you didn't watch live and you caught up with us later, please ask your questions. We'll be glad to answer them. We'll get right to them and answer every question that we see. Big thank you to everyone that has joined us today. We've had a fantastic, engaging Ask Me Anything. We'll be here again next time with another interesting health topic as we share knowledge and get better. Until I come again next time, stay inspired, stay healthy, stay safe. God bless you. Thank you. Yeah, thank you. Thank you, everybody. Thank you.